Hey guys, welcome back to my channel, The ENT Resident. Today we'll be discussing about the different signs that we see in acoustic neuroma. So we have two signs over here that we'll discuss. One, it's the Hitzelberger sign, and second is we have the ice cream cone sign. We'll talk about each one of these signs. What is it exactly? Why does it happen? And why is it named so? You can also now purchase my notes. I have added links in the description. Okay, so let's get started. First, let's talk about the Hitzelberger sign. Now, Hitzelberger sign is actually a clinical sign which is elicited when we are examining the ear canal for the sensory examination. So, what is this exactly? We see that there is hypoesthesia, meaning reduced sensation in the posterior wall of the external auditory canal because of the involvement of the sensory fibers of the facial nerve. We all know that the facial nerve sensory fibers go and supply the posterior wall of the external auditory canal. To know more about the different nerve supply in the external auditory canal, you can check out my video on anatomy of external auditory canal, which I've linked above. So, this particular sign is seen in acoustic neuroma, which is also known as vestibular schwannoma, and this serves to be a very early clinical sign that will help you in detecting or catching a case of acoustic neuroma. Now, so we know that facial nerve has a sensory branch which is known as the nervus intermedius, which supplies the sensory component to the posterior wall of the ESE. In acoustic neuroma, what happens is the tumor ends up compressing the sensory fibers, this nervus intermedius, very early. Therefore, it's a very early clinical sign that the patient portrays. How do you elicit it? You gently touch the posterior canal wall with a probe or a cotton wisp and you try to compare the sensation that the patient is feeling on both the sides. And this Hitzelberger sign was actually named after Hitzelberger, who described the posterior external auditory canal sensory loss as a very early sign of facial nerve involvement in acoustic neuroma. So the nerve involved over here is the nervus intermedius, which is the sensory branch of the facial nerve. And the most common, just a viva question, random one. The most common presentation of acoustic neuroma is unilateral sensorineural hearing loss. And the gold standard investigation for acoustic neuroma is a MRI with gadolinium contrast. A very common MCQ trap that you may fall under, that this we are talking about, that there is involvement of the facial nerve, which is the seventh cranial nerve. It is important to remember that acoustic neuroma is actually a tumor which is involving the eighth nerve. It is not a tumor involving the seventh nerve. This finding that we are seeing in Hitzelberger sign is because the tumor is compressing on the seventh nerve sensory fibers, which is the nervus intermedius. Next is we have the ice cream cone sign. Now, this ice cream cone sign is a radiological sign that we see in a MRI scan. Now, let's see what is this. So, this is a characteristic appearance of acoustic neuroma that we see in MRI. If you look at the image here, this scoop over here, and then there is the cone over here. The scoop is the portion of the tumor which is in the cerebellopontine angle, whereas the cone is the portion which is in the internal auditory meatus. This is the typical appearance of acoustic neuroma on MRI when the tumor has grown to involve the cerebellopontine angle region. So, just to know a little bit more about acoustic neuroma, we know that this is a tumor which arises from the Schwann cells. And the nerve that is involved here is the vestibular nerve. So, this tumor, after it arises from the Schwann cells, it grows into the internal auditory meatus and then into the cerebellopontine angle, and thus giving this typical appearance that we are seeing over here. And this is called the ice cream cone sign because no brainer over here, this looks just like an ice cream, right? So that's why this is the ice cream cone sign that we see in acoustic neuroma. And a very important question that you can know about here is there is one syndrome where we see acoustic neuroma. Can you tell me that syndrome? That is neurofibromatosis 2. So in neurofibromatosis 2, the typical thing that we see is bilateral acoustic neuroma. So you can see there are two ice cream cones that will appear in an MRI in case of a neurofibromatosis 2 case. So that's all about the signs in acoustic neuroma. If you have any further question on this, please note them down in a comment section and I'll get back to you. Thank you.